Good evening, everyone, and welcome to today's Ask the Doc session. We are so glad you could join us. The Ask the Doc is a space where you can hear directly from health experts, get clear information, and ask questions in a safe and supportive environment. Before we begin, I want to share a bit of notes with you to govern this space. So, today's session will only be in English. There will not be any interpretation services during this event. However, we are currently coordinating a Spanish language Ask the Doc session on measles. Our goal is to provide the same information to our Spanish speaking community in the near future. And if you like more details, please visit the Wake County Public Health Population Health's webpage at wake.gov/population health. So, a few housekeeping items to get the most out of today's session. If you have a question, please type it in the chat or Q&A box at any time. Today's session is being recorded so you and others can watch it later. And lastly, we ask that you please keep the chat respectful and focused on today's topic. Now, I would like to introduce our panel. This evening's panelists are Dr. Tony Moody, Director of Children's Health and Discovery Initiative with Duke University, Dr. Ganga Moorthy, Assistant Professor of Pediatric Infectious Diseases and Global Health with Duke University, and Brian Gravlin, Wake County Public Health's Nurse Supervisor. And instead of reading full bios, I invite each panelist to briefly introduce themselves, share their role and organization, and one sentence on why this topic matters. Please kick us off, Dr. Moody.
Sure. Thank you, Morgan. So I'm Tony Moody. I've been doing pediatric infectious diseases now for a little over 20 years, and I work in the space trying to develop new vaccines. I work very heavily in the influenza space. Frankly, I wish we didn't have to talk about measles, but given everything that's going on, I think it's really important that we get out there and talk about, the facts and just really, break down myths as much as we can. So I think it's just such a timely and important topic today.
Dr. Moorthy, would you go next?
Sure. So I'm a infectious disease physician as well at Duke. My role here is to manage our antimicrobial stewardship program, and as part of that, help get the Duke system prepared for infectious diseases, including measles. And my research is based globally, and so this topic is important to me because I have cared for children with measles in international settings and did not think that it would be something that I would be caring for here in the United States. And so, as Tony said, I think it's a very timely and important topic to discuss.
Good evening, everybody. My name is Brian Gravlin. I'm the nurse supervisor at Wake County Public Health Department. And part of my role at Wake County Public Health Department is working with our communicable disease team. And we are tasked with doing the infectious disease investigations for Wake County residents. And I think what's important with measles, especially with this topic, is what role the community plays in managing measles and measles outbreaks. And just getting the information across that's accurate and easy to understand. Thank you.
Thank you all so much for being here and for sharing your expertise with our community. We are really grateful to have such experienced group of experts with us tonight. So, as many of you know, measles has been in the news recently, and some cases have been reported in different parts of the country and closer to home. You may have already heard about measles, or this might be the first time you're really thinking about it. Either way, we are glad you are here and you have a chance to ask questions and get clear answers in real time. So to start us off, we're going to begin with some of the basics. Measles can feel like a complicated topic, but understanding the fundamentals really helps people know what to look for and how to protect themselves and their families. Okay, so let's begin with a few questions to our panelists. Dr. Moody, Could you share, I will start off with you. Could you share a bit about what exactly is measles? And then others, please feel free to chime in and where you see fit.
Sure. So measles is what we call a respiratory virus. That just means that it's spread, through the air and by droplets. And it's a virus that is related to a bunch of other viruses that we typically deal with, like parainfluenza. There are a lot of viruses that are kind of closely related. Measles is different, though, because measles is, without question, the single most contagious virus that we know of. And that makes it particularly challenging because if you get exposed and you're susceptible, the likelihood that you will catch measles is very, very, very high. And that is part of the reason why we developed a vaccine against it. And that's part of the reason why we're seeing the challenges that we've got going on right now. Typically, what we think of when we talk about measles is the rash. That's what a lot of people focus on. But the truth is, there are lots of other symptoms that go along with it. We typically think of cough and runny nose as being a very, very important part of it. You can also have conjunctivitis or red eyes. And then you can have complications from it, and we can get into that as we go along. But yeah, it's just a virus that is very difficult to contain because it is so contagious. And I'll toss it out to Ganga and Brian, and feel free to add to what I said.
Yeah, I'm so glad, Dr. Moody, you pointed out the contagiousness, right? Because that was going to be like, how contagious is it? Is it more contagious than COVID?
Well, yeah, it absolutely is. I mean, when COVID first kicked off, we started having conversations like, could COVID be more contagious? And I think ultimately what we found out is not really. Measles, the problem with measles is that the likelihood of catching it if you're in a room with someone and you're susceptible, pretty close to 100%. It's nothing is absolute in this life, but it's pretty darn close. And that because of that, that means that our vaccine coverage has to be that much higher. That's part of the problem is that in order to cut down on those chains of transmission, person giving it to a person, giving it to a person, you need to have enough vaccinated people around them so that it gets blocked.
And thank you for yeah, thank you for pointing out now how because it's so contagious, tell us a bit about how does it spread?
I'll turf that one to Ganga since
Yeah,
this is the
Dr. Morgan,
space
you
she
want to take
works
that
in. Yeah,
one?
yeah.
Sure. So, like Tony said, it's a respiratory virus. So, it's really spread through droplets. So, secretions, whether that's sneezing, coughing, or any other way that you may be exposed to someone's respiratory secretions. Just to add to what Tony said, if there's one person who has measles, they have the potential to make somewhere between 9 and 12 other people who are not protected sick. And so we think about these scary viruses like Ebola, which we know are really deadly, but they have the potential to only just get a handful of people sick. So, like, somewhere between 1 and 3. So, in the grand scheme of viruses, it is something that one cough could get many people sick if people are not protected.
Yeah, and I'm glad you pointed out the those respiratory symptoms, right? Because those can be very similar. Those respiratory symptoms that we see with measles can be very similar to what people see with other things like COVID and RSV. So, what symptoms should people watch for?
Sure, I can start, and then Brian, feel free to add to this. But um, so measles sometimes can take a little bit to show up if you've been exposed to someone. But when it does start, you usually have redness. So that could be like redness in the eyes, redness in the gums, so really kind of mucosal surfaces. And then you can also have pretty high fever. Sometimes in children that can get up to 104 and 105. And then kids will start to have cough as well. And then a couple days into all of that, they'll start to have the rash that we think about pretty typically with measles. And it usually starts from head to toe. So sometimes people describe it as kind of like dumping paint on somebody. So it really kind of starts at the head and goes all the way down to their toes. At that point, you kind of have reached, the middle of your measles infection. And then after that, there are several more days where you can be contagious even after the rash has developed. But Tony and Brian, feel free to add anything to that as well.
No, I think you were right on point. I think with measles, the beginning symptoms at least do mimic a lot of other respiratory symptoms that we see, especially since we're coming out of respiratory season. As you stated, we're really looking for like that high fever, cough, runny nose, watery eyes. As now that we're getting into pollen season, we're going to be seeing similar symptoms. So we're really looking at high fever in the beginning stages. Usually that I think typically occurs around 7 to 14 days, so about a week to 2 weeks after you've been exposed. And then typically, after you get those beginning symptoms, we start to see tiny white spots in the back of individuals' mouths on the side of their cheek, and then maybe a week later, that's when we're really looking at the rash appearing and it really appearing, as Dr. Morthy had said, starting at the hairline and then working its way down and not sparing any limbs, feet. So it goes all the way down and it sort of heals that same way.
So when we're looking at respiratory viruses, they can typically really impact the younger populations and those of older age. When it comes to measles, though, what do we think? Who is most at risk for measles in those high risk populations that we should be aware of, and they may be family members or loved ones?
Yeah, I'll go with this one. So when we think about who's most at risk for measles, the number one that comes up is individuals who are unvaccinated, or individuals who don't know their vaccine status, may have been vaccinated and don't know. And I think us talking about measles now is a great time to remind individuals to check with your healthcare provider. Make sure that you have been vaccinated. Make sure that those in your family that can be vaccinated have been vaccinated. Because what happens is when those that can be vaccinated are vaccinated, we protect the individuals who cannot receive the vaccine. And then we get to those who are at higher risk of measles complications and contracting measles. And we're thinking of infants that are younger than 12 years old because they haven't met the criteria to get the vaccine yet. We're looking at immunocompromised individuals or people with weakened immune systems. And then also another category of people are pregnant women who are also at risk for measles infection because as you're pregnant, there's a list of vaccines that you are unable to obtain while you're pregnant.
Dr. Moody or Dr. Morthy, would you like to add anything?
I'd just like to add, the point Brian made about not knowing your vaccine status is absolutely critical. And, even if you think you had vaccines as a child, it's always good to go back and verify. And for people who are roughly my age, so I'm in my late 50s, at the period I was, a child when the vaccine was first rolling out, and the vaccine wasn't super effective in the late 60s. And so you may have been in a group that got a vaccine that maybe wasn't as effective as you think it is. And so it's worth having a conversation with your doctor about whether or not you are truly protected. And there's a lot of conversation going on about, should I get a booster? Should I get, another vaccine? I will say that when I entered medical school, they just decided to go ahead and vaccinate me again. So I've had the measles vaccine 5 times now. So far as I know, I'm protected, but it is worth having a conversation with your physician if you think that there's a chance you might not be, fully vaccinated.
And I just wanted to make one point of clarification. I think Brian had mentioned infants, but I think maybe he had misspoken, said 12 years, but it's really infants less than 12 months. Just to
Thank you.
Yeah.
Yes, I did. Thank you.
Yes, yes. Thank you. Thank you all. So speaking of prevention, um, vaccination being the most effective line of defense, but what are other steps that people can take to prevent measles as well? Any one of the panelists want to speak to additional prevention efforts?
Yeah, I think certainly if you know that you've been exposed to measles, I think firstly, isolating yourself. I think it's a great idea, even if you're not sure. The North Carolina Department of Health and Human Services does have the measles dashboard. And on that dashboard, they do have a list of exposure sites that are currently active in Wake, not just in Wake County, but all of the state. And now that we're getting into summer, people are being more transient. It does behoove individuals to take a look at those exposure sites. Were you there during those times? Keeping in mind that measles is still contagious for 2 hours after somebody that has measles has left the space. So taking a look at that, and if you think that you have been exposed to measles, and you don't know your immune status, we do recommend that you check on your immune status. If you find that you are immune, then all you have to simply do is monitor yourself for signs and symptoms of measles, and that's the beginning signs and symptoms that we were talking about, where we're looking at the fever, the cough, the runny nose, and that symptom checking would go on for 21 days. Because it can take up to 21 days after you've been exposed for you to develop symptoms of measles.
And I would just add, I think, one of the key things, and we've emphasized this all along, is that when this thing starts, it looks like a lot of other diseases, right? I mean, there's a reason we call all these things sort of flu-like illnesses, because they all really look the same until the rash appears or whatever, or you get a diagnosis. And so, to emphasize Brian's point, like, until you're sure of what's going on, protecting other people is one of the best things that you can do. And since you're really, with measles, you're quite contagious for the 4 days until 4 days before the rash appears, you could be spreading it and not realizing it. Maybe your fever isn't that high or you just don't feel that bad, but you could still be spreading it around. And then you get the rash and like, oops, which is a kind of bad oops to have.
So staying on the topic of vaccines, who should get vaccinated? We also know that some people may not be able to get vaccinated. Could you speak to the groups that may not be able to, but also the groups that definitely should be getting the vaccine?
Yeah, I would say that, the key thing is that if you're immunocompromised, that's going to be the biggest group that's going to have a challenge, because there are people who are really not able to take live virus vaccines because of concerns of what might happen with that. I can't emphasize enough, just have a conversation with your physician about this. I mean, there's good guidance out there. And if they have questions, they can always call us. These are the kind of calls that we get about a specific case. But otherwise, if you're a healthy person, you can get vaccinated. And that is without question going to be the best thing that you can do to protect yourself. And we might get into this later, but I can just say, with vaccine, kids typically get the vaccine twice. They get a vaccine somewhere between 12 and 15 months, and then we give it again at 4 to 6 years. It's not technically a booster in the way that we typically think of a vaccine, the way that we do for things like, pneumococcus or tetanus or whatever. It's really to catch people who maybe didn't get good vaccine uptake at that first time that they got the vaccine. But, absolutely, if you're an adult and you're concerned about it, have a conversation. I can't tell you how many of my adult friends I have had ask me about this. I have had a number of my adult friends just say, you know what, I'm getting it because I just don't want to have to worry about it. And that is entirely reasonable. But have a conversation with your physician, and then thank you. You've put you put some excellent stuff here on the screen. I mean, there are lots of resources that are available to the community, and prevention in this case absolutely is better than trying to do anything else. So.
And Tony, the only thing I would add is I think, there's a lot of questions about very young infants, so children who may be less than 6 months, who may not be able to get the vaccine, and also people who live with people who may be immunocompromised. And we can talk a little bit more about those exceptions, but I would just add that if you're living with someone who is immunocompromised, it is not a contraindication, or there's no reason why you couldn't get the MMR vaccine. Sometimes that question comes up, and that is totally safe for you to get it. And so talking to your doctor about that is great.
Thank you so much, panelists. And yes, we have some great resources here on the slide where you can get vaccinated in Wake County. So do jot those down. So now that we've covered some of those basics, thank you all so much, panelists, for walking us through those important basics. Now, how it spreads, what exactly is measles, what people should watch for. And we want to open up the conversation a bit more. So some of you've submitted questions when registering for tonight's event, and we've also are receiving questions live from the audience. So in this next portion, we'll be a bit more of open discussion where we will address those questions directly. So our goal tonight is to make sure you leave clear, practical information that helps you feel informed and prepared. And so let's tune into some of those questions now. So we do have a question. You may have spoken to this already, Dr. Moody, but again, thank you so much for the important information. If you are immunocompromised, should you get an antibodies test to see if you need a booster?
So it's entirely reasonable to get an antibody test. Your physician can order that, and they're just testing for antibodies against measles. That is an absolutely reasonable thing to do. I think it's a little difficult to make a blanket statement about whether or not the result of that test really tells you exactly how protected you are, because we know that the kind of immunity that you really need against viruses, the antibody's only telling part of the story, and it's very difficult to do the kinds of tests that we would want to do to really interrogate the immune system and say, do you have the kind of immunity that you think would be protective. I think that when you go on therapies, whether that is chemotherapy and you're immune compromised from that, or you're on drugs because of an autoimmune condition or whatever, you have a conversation with your physician about what things you need to be careful about. This just falls into that same category. Granted, given the contagiousness, it can be a bit more concerning, especially in a time like this when we seem to be having so many more exposures. But I think getting an antibody test is a great first start. And what I would say is that if your physician is concerned or doesn't really understand how to interpret that, they call us up. That we provide these kinds of consultations all the time. Call the health department. You will have the information. There are excellent resources out there if your physician doesn't feel comfortable ordering or interpreting the test. I think there are lots of resources that are available for people to really decide how to both test and interpret that test and what to do with that information. I think it's a great idea because if nothing else, it starts that conversation.
Thank you so much, Dr. Moody. Staying on the lines of kind of vaccine and should I do this, should I do that? Another question that came in, my child is a transplant recipient and cannot get the measles vaccine. What signs of spread should I look for, maybe considering homebound schooling? Dr. Morthy or Dr. Moody?
Sure, I can start, Tony, and chime in. I think these situations can be really challenging, and it's a question we've been asked a lot in terms of what should we do knowing that there is measles in North Carolina. And I've tried to say that really, if you're starting to see more than 3 cases in the county or the area that you live in, it may be a good idea to think about kind of your plan if you have someone that could be at risk. Right now in Wake County, we do not have that. And so I think there's still a little bit of time to think through what that could look like for you and your family. And your pediatrician is a good partner to help you think through what the best next steps for you and your child are.
And I agree with everything that Ganga just said. I think it's important for people to recognize that there is nothing in life that is perfectly safe, but there is also a great deal of space between I'm going to stay at home and not expose myself to anything, and I'm not going to do any kind of protection at all. There's a lot of space between those two positions. And I think it's important for people to recognize that you still have to live your life. You still have to go out and get groceries and do all the things, but you also don't have to accept undue risk. If you know that there are cases in the community, just like Ganga said, like that would be a time to maybe back off. And so I think you have to take it sort of the same way you take the weather. You might not carry an umbrella every day, but there may be days you should do that. So.
Absolutely. Good, great way to think about that. Another question I have for the panelist. What some early symptoms should parents look for, and how do they tell the difference between measles and other common illnesses?
Whew. Yeah, I mean, we spoke to this a little bit before, and it's really challenging because all these diseases basically look the same, right? You know, and Brian made a really good point. We're heading into pollen season, and so everybody's got a runny nose. Everybody's feeling a little, the back of their throat. I mean, it is the challenge, right? That you're living in the world, and these are the symptoms that you're going to have. I think it's very important to be honest with yourself. Am I getting a fever? Am I feeling worse than just, I would normally expect to feel? Is my child maybe, not acting the way that they would normally act? And just have a high index of suspicion. You just have to be really thinking about it. And this is fundamentally actually one of the big challenges of measles. Back 60 years ago, when it was very, very common, it was really easy to diagnose because everybody had seen it. Ganga's seen a lot of cases because of her work overseas. The healthcare community just doesn't have as much experience with it now. And so that's one of the challenges we have, is just that not everybody is thinking about it. And it's really hard to make a diagnosis if you're not thinking about it. And there are obviously those signs that you might look for, the spots in the cheek and that sort of thing, the red eyes. But of course, red eyes from pollen. I mean, it's a real challenge. And of course, I'm standing here thinking about it and I'm going, are my eyes itchy? It happens to all of us. So
Yeah, I think taking that in consideration and then also looking at potential exposures that you might have had. If you think your child is having symptoms of measles, start thinking and looking at the exposure sites. Did somebody come visit you for a week and they lived in, let's say, Buncombe County, where there are having multiple cases? That's an indicator that, oh, this could potentially be measles. And, rather than rushing to your pediatrician's office or a doctor's office in urgent care, in that situation, we always want to caution individuals to call first and say, hey, there's a potential that my child or myself has measles, and then they'll give you the directions as far as how to proceed going into the urgent care, ER, the doctor's office. Um, I think ERs, all the local ERs, and even not just local ones, are all already prepared for measles in case they come in. They have isolation rooms where they can set people in. That way they can limit the spread to other individuals in the hospital and then other patients that may be at risk for measles. So I think certainly looking at your risk factors, and I think like Dr. Moody said, just being honest, were you in a place where there is an exposure? Are you having some of those beginning symptoms? And do things is everything lining up? Or, if you look back and say, we didn't go anywhere, we haven't been anywhere, then sort of looking at that. But again, like Dr. Moody said, if things start progressing and getting worse, then yes, then I would certainly start questioning that, especially if Wake County begins to start seeing community spread of measles, then it would be a more common indicator of, yes, this could potentially be measles.
And the only last thing that I would add is just, in addition to thinking about symptoms and kind of your exposures, just thinking about your own personal risk. And if you are vaccinated, you are very well protected against measles. So one dose of the vaccine is 97% effective at lifelong immunity, and 2 doses is 99%. So if you are vaccinated, your risk is very low. And so that hopefully can give you a little bit of, solace as well.
So speaking along the lines of like being exposed and maybe if you've traveled to like a recent area that has had measles cases, how long should someone stay home if they've been exposed or if they develop symptoms? I'll put Brian.
Oh, it doesn't matter either, myself or Dr. Moody.
yeah.
So I was just going to say, if you are exposed to measles, and this goes back to what Dr. Morthy had just stated, if you are immune, then there's no exclusion for you. You've had both vaccines, you're considered immune. You're just self-monitoring for 21 days. We do ask if you develop any signs or symptoms of measles, then you immediately isolate yourself, call your provider, because testing would need to be indicated. If you are not considered to be immune, which is having 2 vaccines, then yes, then you would be quarantined for 21 days after that exposure. And that's just, again, because it can take up to 21 days for an exposed individual to show signs or symptoms of measles. And if you're exposed we do have the ability of doing what we call PEP or post-exposure prophylaxis. The window period for that is relatively short. It's 72 hours after your exposure to get a booster vaccine, which would limit that, but that would not decrease your need to also quarantine. It's just the likelihood if that's given, the likelihood is that it's going to decrease the severity if you were to get measles.
Thank you so much, Brian. And so going back to kind of this some similarities between allergies and respiratory viruses, we have another question. So I'm hearing that spring allergies will make it hard to tell the difference. What extra steps can we do to protect ourselves, even if we have the vaccine?
Yeah, I think it's the same situational awareness stuff that we've been talking about all along here, right? What's happening in your local community? Is it your car is green and you've been exposed, or your car is green and you're not, you haven't been any place. I think Brian, really hit the nail on the head just a minute ago that, if you've really not been exposed, then I think you can easily slide over and say, well, this is unlikely to be this problem. But if there's a lot of circulation in the community, then I think you sort of have to tip yourself over to going, well, maybe I should be more cautious here, especially if you're thinking about, well, I'm supposed to go see grandma this weekend, but grandma's on chemo, or all of those kind of things. I think it's just each person's life is individual, and you kind of have to individualize the recommendations for that reason. Yeah, I wish I could give you a blanket like you blow your nose and it looks like this and this would be the answer, but it's just not the way it works. Sorry.
And speaking of maybe individuals going to go see grandma, like infants, right? That are too young to get vaccinated. How can families protect them? What are their risks?
So, the measles vaccine, as Tony said, is typically given around 12 to 15 months. So really kind of in that first year of life. You can get the vaccine as young as 6 months of age. There are some nuances to that. And so that's a conversation to have with your pediatrician, and you can also reach out to us just about whether or not it makes sense for your child to get it. But for those who are less than 6 months of age who really are not able to get the vaccine, I think thinking about risk in terms of personal risk as well as situational awareness, and potentially if there is community spread or multiple cases in your county or your area, just thinking about where you're taking your child. So avoiding large groups, trying to keep them, close to people that are vaccinated. And then, thinking about for yourself, if you are someone who is immunocompromised or potentially non-immune, just, thinking about wearing a mask if you're in places like that to help protect the people that are around you.
And I think that goes back to what public health always talks about is the herd immunity that we always hear about. We want a vast number of people in the community to be vaccinated to protect those individuals that are unable to be vaccinated.
Absolutely. Thank you so much for adding that in, Brian. Dr. Moody, were you going to say
Well, I
something?
was just going to add one more thing, and I think this is something that, I think we have to be honest about this, that, if you look at the recent cases that have happened over the last 2 years, there are people who have a history of vaccination who have gotten infected, right? This is nothing in medicine is 100%. Now, it is highly effective, but it's not perfect. Nothing is perfect. However, I think I know there was a recent report that was put out about the exposure that happened in the Denver airport last year, which I think is very, very telling. There was a person who was unvaccinated who came and sat in the lobby and infected several people, and then got on an international flight and infected several people. All of the people who required hospitalization were unvaccinated. All of the people with documented vaccination did not get hospitalized. So if you want yet another reason to get vaccinated, not having to be hospitalized is a pretty good one, I think.
Thank you so much, Dr. Moody. And on that tip, what are some of those long-term complications that people can see with measles that they need to be aware of?
Yeah. So, I mean, measles has the potential to create a number of problems, both in the short term and in the long term. So, in the short term, I mean, there's a not insignificant chance of death just due to the complications of measles. And so I don't want to discount that. You can get fulminant pneumonia, so you can, wind up having very great difficulty breathing, and you can have longer term consequences from that. There's actually a fairly large proportion of people who end up with hearing loss due to measles infection. And then there's a number of children and potentially adults as well can wind up with neurological complications from it. And then there's a very long-term complication that can occur. It's called subacute sclerosing panencephalitis, or SSPE. That typically doesn't appear until like 8 to 10 years later. Right. And so that is one of those things that you could have it recover and then much later wind up with a severe complication. And so, yeah, there are all of these things that actually contribute to creating problems. There's also data from the laboratory side that suggests that measles actually affects your immunity to everything, and that it really makes you more susceptible to other infectious diseases even after you've recovered, and that can take several years actually for your immune system to kind of get back to normal. And so, people tend to think of it as, oh, it's just a childhood rash. Oh, it's just a typical childhood illness. And yeah, but one with a lot of complications. So, yeah, I'd be happy to have anybody else chime in too.
Yeah, I'm glad you spoke to kind of something maybe like not a myth or something that maybe a misconception that people have around measles. And we're going to actually get into some of those and debunk some of those myths and whatnot later on as well. Thank you so much, Dr. Moody. We have another question that came in. Where's the best place to track the circulation in our community?
So right now, all of our exposures that occur in Wake County would be on the North Carolina Department of Health and Human Services website of exposure. Wake County Public Health also has a website where we will track if there's any known cases in Wake County. And currently, we don't have any cases in Wake County. And we will also post that. We will make sure that media outlets are aware of any exposure settings that are going on. If we had any cases that were going on, and we try to be as transparent as possible in notifying, is that person who's positive, were they connected to a known outbreak? Were they not? Because like we talked about, being connected to a known outbreak, we can pin somebody to that, versus if they're not, then we might be thinking that it's in the community and then it's community spread, which is a little bit different of a scenario.
I know that there's spring break is coming up, and so people will also be traveling. The CDC has information about kind of where there are hotspots nationally as well, in case you're going somewhere in the next couple of weeks or months.
I
I think
believe.
that brings up a good point, Dr. Morthy, is looking at measles is still being spread in other countries. So if you are doing international travel, being aware of where it's currently being spread, and potentially getting yourself a booster or looking at your vaccine status prior to going. And that could just be if you're going international flight, if you're going on cruises, things like that, because people from all around are joined into a single space, occupied space, multiple people. So just be aware of that.
And I mean, that ties into all the rest of the things you should be thinking about before you travel. Is your tetanus up to date? If you're going to a yellow fever endemic country, do you have that back? There's just so many things that you can do to protect yourself. All of those things are worth considering. And this is yet another thing that you really should be paying attention to.
Absolutely. And I believe we'll probably be sharing some resources, such as like the North Carolina Department of Health and Human Services measles page and the CDC's page. So the audience members and others can have that information to prepare. So I want to touch on a little bit of something that we brought up earlier about if I've gotten vaccinated, can I still spread measles? So would our panelists kind of speak to that? Dr. Morthy or
Yeah,
Dr.
you
Moody.
want to take it, Ganga, or you
Oh,
want me
I
to?
was going to say, Tony, you're the
I mean,
vaccine expert
so
between the two of
so
us, so I
yeah.
was going to let you take
Well,
that one.
so I think let's talk to what the data are, right? And this is one of these places where we probably don't have as much data as we would like, right? So, like I mentioned, there are absolutely reports of people who have a vaccination history getting infected. What we don't really have are perfect data on how transmissible those folks are. We think that getting a vaccine reduces your ability to transmit. Unfortunately, with measles, is that you go from 12 people to four, or we don't have great numbers around that. We think that that is the case, but I don't want to oversell data that we just really don't have. And I think part of the challenge is the vaccine was so successful at cutting down on transmission, we just stopped doing those studies. I don't particularly want to have to do those studies now, but we actually have had conversations about it, about whether or not we should start collecting those kinds of data. And it is something to consider.
Dr. Morthy, were you going to add anything? So, staying on vaccinations and exposures, when it comes to if you start to see cases in the community, um, safety wise, is it safe to go to daycare, playgrounds, other school activities, um, just day to day life activities? And what does that look like?
Man, I think there's a lot of considerations in this. And in some ways, it's the same kind of considerations we had during COVID, right? So there is a difference between going to a public space where there's a lot of air circulation versus going to an enclosed space, and how densely packed are you, and all of those kind of considerations. I mean, this is an incredibly contagious virus, but there's a huge difference between sitting in an office with me versus standing outside and having a conversation around a picnic table. And again, it's not going to be like there's a bright line cutoff of this is safe, this is not safe. It's all about kind of risk stratification, which is what we do with everything, right? I mean, this is the whole point of being, a parent and a pediatrician and a healthcare provider, is you're kind of stratifying all of this stuff. Yeah, I mean, if you're fully vaccinated, again, I would think that those things, would be safe activities, but I think it's important to recognize that nothing is without risk in this life. Ganga, what would you like to add?
Oh, I was just going to add, Brian touched on earlier the importance of herd immunity with measles. And, you can think about herd immunity at multiple levels. That could be at, a national level, a state level, a county level, a city level, and then also at the community level. And so just thinking a little bit about what is the herd immunity in your exposure area and what those exposure patterns, information about vaccine rates are available for public schools. So if that's of concern to you, that information is there. And the other thing you can just think about are who are you around and who are your children around, and are those people that is that herd immune, and that can help with some of your choices as well.
To amplify that, I mean, if you look at the data from the places where the outbreaks have occurred, West Texas, Alberta, South Carolina, they are in places where there were very low vaccination rates. That's what really helped sustain this. So, yeah.
Absolutely. Right information. Thinking about being exposed, um, how quickly should someone get tested if they've been exposed, or if they actually start developing symptoms, should they be tested? I'll take Ryan.
Yeah, I can take that. So when you're initially exposed, I would have to, oh, that one's a hard one, right? We want you to be tested, and really around the testing really becomes really around symptom onset when you start developing symptoms, and then really going to see your doctor and getting a nasal pharyngeal swab or a throat swab to confirm whether or not it's measles. So it really would look at when your symptoms started to develop. after you've been exposed. And secondly, it would be when we do our investigations at Wake County and Public Health in general, we take all of this into consideration when we're doing your risk exposure. We're looking at where have you been, what's your vaccine status, what's the likelihood that this could be measles, and we even go through the process of tiering individuals on a tier system of how likely is this to be measles, and then based on that, we do make contact or contact is made with everybody who's been exposed that we're aware of. And those individuals are either monitoring themselves or we do what's called active monitoring, where we would call that person every single day to say, hey, how are you doing? Do you have any signs or symptoms? And in the literature that we supply with that is the moment you develop symptoms is when we want to know. That way we can get you tested and we can confirm or deny whether it is measles at that point.
And I would like to throw in there, thank you for bringing that up, Brian. I like to throw in there that the North Carolina Department of Health and Human Services does have a page on what to do if you're exposed. And they also provide a phone number that may be contacting you if you've been exposed. So it's a great resource. They also have shared a dashboard so you can see where cases are located throughout the counties, throughout the state in different counties. And they also have, speaking to knowing vaccination rates per counties or per schools, they have another dashboard that you are able to find that information out if that's if you're interested in that. So moving things along, thank you so much for the questions that have been sent in. And so for like the next round, we are going to continue addressing questions and maybe focus in on some situations people often wonder about. You know, still things like exposure, vaccination, what to do if measles is suspected, but also want to provide some clarity maybe on some common myths and some or concerns that people have. So starting off with a bit of a maybe misconception to address. Is measles only a risk during international travel? We spoke to maybe summertime travel and whatnot. Is measles just a risk when people travel internationally?
So it is a risk depending on where you're traveling internationally, and currently it may be a risk depending on where you're traveling domestically, given that we do have some outbreaks in certain states in the United States right now. And Tony and Brian, feel free to chime in on that.
No, I mean, there's just a lot of countries around the world where measles continues to circulate. And given how contagious it is, it's just, it's one of those things you can pick up. And given, Brian talked about this earlier, given the long incubation period, you can pick it up, fly home, boom. I mean, and that's what we've seen with a number of outbreaks. Outbreak in New York about 20 years ago had that. It was absolutely the kind of thing that it's very easy to bring back. And so that's one of the reasons why we're always, ID docs love to ask questions anyway, so we're always asking about your travel history and that sort of thing. But yeah, it's just that so many places around the world don't have good vaccine coverage. Their healthcare infrastructure is not set up to really contain these things. And so, yeah, it's actually a shockingly common illness around the world.
Yeah, and I would just agree with both of them and say I think prior to the current cases that we had in the United States, even back in 2025 with Texas, we typically only saw measles as an international income into the United States. So we would get notifications that there was somebody with measles on a plane that traveled international. And then respective health departments, states would be notified of that exposure. That was a common occurrence we would see. And so now it's less likely that we're seeing measles as being an international problem and more of a domestic problem because we're seeing, as everyone has seen, the Texas outbreak, and then we are now seeing the South Carolina outbreak. And there's a great map that the CDC has, and I believe it's on the state's website as well, that shows every state in the United States that currently has measles cases in it. And it's almost all U.S. states that currently have confirmed measles cases. So no longer international or what we think of an other country's issue. Now it's here.
It's here. Absolutely, it's here. Thank you all so much for addressing that misconception. Another one that that you may have heard about and we see, can the MMR vaccine cause measles?
Sorry, I had to get to the mute, but no, 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 no. Vaccines do not cause the disease. Sorry, it's one of the things. It's one of the big misconceptions that we deal with all the time. Everybody's like, I got my flu shot and I got the flu. No, that's not how that works. Um, so the vaccine that we use for measles is what's called a live attenuated virus. It's a virus that has been grown and weakened so that your immune system still sees it, still recognizes it, and is able to develop an immune response to it. But you cannot get measles from the vaccine. Now, one of the components of the MMR vaccine, the rubella component, is one that we worry about giving to pregnant women because we don't want that vaccine component to go on and cause congenital rubella syndrome. But no, the measles, the MMR vaccine is incredibly safe. I I don't know if you want to get into the whole autism debate or any of that kind of stuff. That's a whole separate. I have an hour-long talk I could give on that. But it's fantastically safe. You're not going to get the disease from the vaccine. In fact, and you know what? Maybe this would be a good time to show a graphic because I have a really good graphic about this. Let me just get to the right slide. There it is. And let me share because this actually came from Peter Hotez, who is a wonderful infectious disease physician in Texas. And so this was a graphic he put together for an article in the New York Times. And what you can see here is on the left-hand side, this is people who get measles. These are the complications that they can get. So you can see that out of 10,000 people getting measles, about 20% of them or 2,000 people will get hospitalized. About 1,000 people will end up with ear infections and potential permanent hearing loss. About 500 will get pneumonia, so about a pretty substantial people, and then you'll have child deaths, potential encephalitis, that sort of thing. On the right-hand side, this is the effects of the measles vaccine, right? So there are a handful of people who could get fever-related seizures to it. There's a very, very small number of abnormal blood clotting incidents that will occur. They essentially all recover from that. And then there's as with anything, you can have an allergic reaction to just about anything. And so there's a very tiny number of allergic reactions. So you can see that, the vaccine itself is profoundly safe, especially compared to the actual disease. And so, yeah, it's, I think, just a really important thing to emphasize that the vaccine is really safe. It has been used in millions of people. It is absolutely the best way to prevent disease.
Thank you so much, Dr. Moody, for sharing that. And I'm so glad you touched on kind of those reactions possibly after you. Can you speak more to that so parents can maybe be aware of or be on the watch out for what they may see with their child getting the vaccine?
Oh, sure. So, I mean, obviously, it's going to be things that parents would be looking out for anyway, right? I mean, so, there are kids can get a little bit of an elevated temperature with vaccines. You can see sometimes that they can have a seizure associated with it. Generally, those are not felt to be, indicating that someone's going to have a seizure disorder later in life. That's a sort of long and complicated area that pediatricians get trained in very well, and the pediatrician should be very comfortable with that. With an allergic reaction, if anybody has an allergic reaction, you should see it fairly quickly, and we have treatments for that. For the abnormal blood clotting, typically, it has been observed. It is something that has been observed in a large, when you give it to a large enough number of people. But like I said, it is something that typically just resolves on its own, and it, is not a complication that we're particularly worried about. The general rule that I give with anybody is if you're concerned, call your doc. It's what they're there for. So, and the way that I've always handled it with all of my patients is if you're worried, I'm worried. Call me. If it's an easy question, then fine, it's an easy question. And if it's not an easy question, well, I'm very glad you called. So
And then, Tony, I was just going to add, we highlighted some of the pretty uncommon side effects or complications from the measles vaccine. Things that you can see maybe more commonly are fever, which happens with many vaccines. Some children may have some redness or swelling at the site that they had their injection. Very rarely, sometimes kids get a rash that's more all over their body, but that is very rare. And then some kids may have, with any vaccine, you can sometimes have a little bit of joint pain that usually resolves on its own. And then occasionally you can feel like a big lymph node. So if you're giving your child a bath and you feel something maybe like in their armpit or in their groin, that is just the body doing what it's supposed to do with what the vaccine gave them. But those are things that people see more commonly with any vaccine, including the measles vaccine.
Thank you so much, both of you, for covering that for audience members. Another question. So thinking about adults, so moving to the adults, once they get the vaccine, do they ever have to think about measles again? Um, is
Well,
it like,
unfortunately, we're all having to think about it right
yeah,
now. So I would say this is another one of those places where we have some data and we don't have all the data that we might necessarily want. So, oddly enough, I was just emailing with a colleague who did a fantastic study on this years ago. So there was a fantastic study that came out of Oregon looking at the durability of your immune response to measles. And basically, the data that they have showed that your measles immunity lasts for your entire life. Like it just doesn't go down. So once you're immune, unless you have, you start chemotherapy or you're on a drug that might affect your immune system or that sort of thing, you're pretty much good to go for your entire life. What we don't have now are data that sort of follow on to that because all of that was done on samples that were collected, essentially from like 1930 up until about 1990, 95. We don't have data that sort of carries that on in the more modern era. And so, is it possible that there might be a decline in immunity? There absolutely is a possibility. That gets back to the thing that we were talking about before about getting an antibody test and talking to your physician, all of which I think are eminently reasonable. And we are doing more things to people now because we have more specific therapies, for cancer, for autoimmune diseases. People are living longer. We don't have data in those populations. So what I would say is, to the best of our knowledge, once you have vaccine and you've got good coverage, you should be good. But then again, like with anything, your mileage may vary. So, I think it's worth just having that conversation with your physician.
absolutely. Thank you so much, Dr. Moody, for covering that. So, as we begin to wrap up this tonight's discussion, we'd like to take any few final questions, but also ask the panelists to share a few key takeaways for our community. We've covered a lot of information. Thank you so much to our panelists this evening for how measles spreads, what maybe reactions people may see if they get vaccine, what are the symptoms, where you can find information, resources on community spread or spread throughout the state. And how really families can protect themselves, but also others. So we invite each of our panelists to briefly share one or two key messages they hope that everyone watching tonight will remember. And we'll do the opposite this time. We'll start off with Brian.
Thank you. That is very perfect. So I think I'll start where I sort of began, right? So I think the most important thing that parents and others can do to help protect their families and communities from measles is to make sure everyone who can be vaccinated is vaccinated. If you have questions, like Dr. Moody and Dr. Murthy had stated, call your provider, call the public health department, ask us the questions that you have. Let us be that sort of backbone, that sounding board of questions. If we don't know the answer, we have contacts to somebody who has the answer for us, and we will do everything we can to provide that information to you. I think making sure that you're finding reliable information through websites. I really pause when we're looking at like Google AI or things of that nature. I really support sticking to our Wake County Public website, Duke's website, UNC's website, Wake Med's website. NCDHH has great information. Again, knowledge is power. Knowing where the exposures have occurred, not only in Wake County, but also nationally and internationally, also just keeps us situationally aware.
Awesome. Awesome. Thank you so much, too, for putting the plug of those resources and those trusted messaging places where people can get the information they need. And also utilizing the very people on this call, right? The healthcare systems, the public health department to reach out to when you have questions. Now, Dr. Morthy.
It's hard to follow Brian because he hit all of the the pearls. I think just to echo what he said, I think public health takes everyone, which is the public, and so thinking about how can you best protect yourself and your family, but also your community, and getting vaccinated is really the best way to do that. And then just also saying that you know doctors are happy to answer your questions, and I think this can be a really stressful and challenging time for people and for families, and I totally appreciate the concern, especially now that we have seen cases in North Carolina. And there are so many resources, including the public health department and physicians, who are happy to have these conversations with you and figure out what is best for you and your family.
Last but certainly not least,
Sure.
Dr. Moody.
I mean, honestly, I think my colleagues have covered it all. I will say we are incredibly lucky in North Carolina. We have an excellent state health department. We have excellent local health departments. They really do outstanding work. And the availability of resources, like was mentioned before, I mean, you can go on the state website, you can see what the vaccine coverage is in your school. You can ask, am I in a pocket, or am I in a place where I can feel comfortable? That kind of data is power that really gives you the opportunity to start asking questions about what's going on in my community and how safe do I feel, and make informed decisions, which is ultimately, that's really what we want to see people do. Have the data.
Well said. Well said. Thank you so much to our panelists for sharing your expertise, and to everyone who joined us this evening. Before we close, and we have a survey that is going to be provided shortly, or by arriving by email to you. So please take a moment when you have a chance to fill out that brief survey about tonight's event. Your feedback helps us improve future Ask the Doc town halls and better understand what information our community needs most. So, on behalf of Wake County Public Health, and thank you for joining us and taking time to learn more about measles and how we can work together to keep our community healthy. For ongoing updates around measles in Wake County, please visit wake.gov/measles. And we also have another resource that is available in the chat when you get a chance. It is the North Carolina Department of Health and Human Services measles cases and outbreaks page for you to know about what to do when you get exposed. They have those exposure locations. You can see where cases are at throughout this state, amongst other resources available to the public. So again, thank you so much, you all, and hope you have a safe and wonderful evening.
Great. Thanks. This was fun.
Thank you. Thank you all.